Hi, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. Interesting article came out in the Annals of Medicine recently that looked at folks who have rheumatoid arthritis, were treated with methotrexate, and they wanted to measure various cardiovascular risk factor variables. And what they found was that people on methotrexate with RA, their blood pressure came down. Now, this is interesting because high blood pressure is a significant risk factor when it comes to cardiovascular disease, and we know that rheumatoid arthritis patients have higher rates of cardiovascular events as well. So we know that methotrexate does not inherently lower blood pressure or treat high blood pressure, but by reducing the overall inflammation of rheumatoid arthritis, it seemed to have an effect in terms of reducing high blood pressure and blood pressure in RA patients. Now, this fits with what we know in other studies in RA, that controlling RA with disease-modifying treatments seems to reduce the events of cardiovascular disease as well. What I find interesting about this study is that it's now looking at the connection between your immune health and inflammation and your metabolic health. So based on some of these studies that we're seeing in RA and psoriatic arthritis, I think there's a pretty good connection that we're realizing between inflammation and metabolic health. So in other words, between the inflammation you may have in your joints, as well as the kind of cardiovascular disease that can happen in those individuals as well, including how it can affect things like your cholesterol, your blood pressure, and rates of cardiovascular disease. But what's fascinating is that it's probably not just a one-way street, meaning immune health and inflammation with metabolic health probably goes the other way as well. Namely that you can cause changes in metabolic health that then lead to changes in your inflammation. So from a practical standpoint, if you're living with chronic inflammation or a chronic autoimmune disease, one of the things that you can do to help yourself out is by working on your metabolic health. What that means is by eating a diet and focusing on nutrition that helps to reduce your inflammation level, and by doing a lot of regular physical activity and exercise as well. Knowing that by controlling your blood sugar, improving your cholesterol, including improving your high blood pressure, may also have a benefit on helping your inflammation as well. In addition, over the next 10 years, you should expect to see more and more studies that will show that treatments that are meant to work for inflammation are now also helping your metabolic health issues as well, whether that's diabetes, blood pressure, heart disease. And on the flip side, you'll start to find that there's more and more treatments that work on metabolic health that seem to also help with autoimmune issues and chronic inflammation issues. One of those possible options could be in using GLP-1 agonists, things like semaglutide and tirzepatide, that help with blood sugar and metabolic health, and that for those of us who see a lot of chronic autoimmune and inflammatory patients, find that in some of our patients who are on GLP-1 agonists, that some of them do also get benefit when it comes to their inflammation as well. So expect to see more of that going forward. And in the meantime, work on your diet, work on your exercise, work on your own metabolic health.